The next step is the stabilization of the complex fracture of the ulna, using the bridging internal fixator technique with an 11-hole 3.5 LCP. The following instruments are needed: the toothed reduction forceps, the 2.8 mm LCP drill bit, 2 LCP drill sleeves, the depth gauge, the screwdriver's shaft, with the 1.5 Newton-meter torque limiter and its handle. Because of the intermuscular membrane between the radius and the ulna, an approximate reduction of the length and the alignment of the ulna will have taken place during the fixation of the simpler radius fracture. As a rule, the plate does not have to be contoured to the straight shaft of the ulna. In the exercise, the plate is fixed to the distal main fragment with reduction forceps. In a clinical environment, the plate may be inserted subcutaneously with the help of the LCP drill sleeve, leaving the fracture area unexposed. Bicortical locking head screws are inserted into the end holes of the plate. These two screws still allow limited correction of the axial alignment, but no correction of the length or rotation. The threaded drill guide is carefully inserted into the corresponding part of the combination hole. A hole is drilled using the 2.8 mm drill bit. After removing the drill sleeve, the length is measured. Locking head screws are best inserted with the torque-limiting screwdriver attached to the power drive. However, the last few turns must be made by hand to prevent over-tightening the screws in the plate holes. At this point, if the other end of the plate is not well secured, the helicopter effect may occur. Before completely tightening the first screw, the plate is fixed to the bone using the most distal plate hole in the same manner. This screw may be fully tightened, which is signaled by a click. The first screw is now fully tightened, again until a click is heard. Two more bicortical locking head screws are inserted close to the fracture area in the same manner as before, with two screws in each fragment, leaving one hole empty between the two. Adequate stability to bridge the complex fracture is obtained. This exercise has illustrated how the LCP can be applied in two different ways. First, as a conventional compression plate for the simple fracture of the radius, and then as a purely internal fixator to bridge the complex fracture of the ulna.